Department of Health is urging South Africans to go for regular cancer screening and testing to ensure that the disease is detected early. The department is holding its cancer awareness drive in Hurst Hill, Johannesburg. Deputy Minister of Health, Dr. Sibongiseni Dlomo, is also expected to join the cancer awareness outreach program that is in collaboration with the Pink Drive organization as part of World Cancer Day commemorations. Newzroom Afrika's Tumaole Mohlaoli is standing by to join us and tell us more on how that drive is going. Tumaole.
Well, a very good afternoon, Aaron. And the drive here can be summed up as having been successful in the sense that, of course, Dr. Joe Phaahla, the Minister of Health, has also joined proceeding. And he has spread a message saying that on such a day it is important for people to go and to get screened. Not only women but also men. Cervical cancer is something that is quite prevalent amongst women in South Africa, but also prostate cancer is a big problem in South Africa for men. So both sexes being urged to go for screening, and should they be found to have been showing symptoms or having symptoms of that cancer, to get treatment as early as possible. So this is the message here. But I'm joined now by Dr. Phaahla himself. Dr. Phaahla, would you say this Pink Drive was a success today, and the message, do you think it will reach its intended recipients?
Well, thank you very much indeed. We are very grateful for this partnership with Pink Drive. It was very important that we have this activity here on World Cancer Day in terms of public awareness of cancer, but doing it also while providing a service in terms of the screening, because what is important amongst our people is to be aware that cancer is there and it's a serious threat to our health. It needs to be detected early. If it's detected early, there is possibility that it can be treated and can be cured. So I believe that it was very important that's why we are here to work to support the Pink Drive on this very important World Cancer Day.
You also gave a special praise and mention to Pink Drive founder as well was here, and it seemed as if it was extending an olive branch, maybe mending some relations. What's been the genesis of the strained relations, if one can read into that way?
Well, I wouldn't really call it a strained relationship. Nolin and her team are very passionate, very resilient, and all that I was saying is we know that we're not always meeting some of their expectations. They would want to expand, and we support it. We support it. I mean, from the time when I was appointed as a deputy minister, I've been working closely with them. We've only disrupted by COVID, together with the Deputy Minister of Social Development, Deputy Minister Henrietta Bogopane Zulu. She's very close to their team. She works very closely, and we work together. We have been working together in that. So, but as, for instance, she was explaining that sometime in terms of some of the regulatory environment, even resource support, they make requests for this and that. We're not always able to meet their expectations. But I was just saying that even when we don't meet all their expectations, they must know that we really appreciate their contribution. We understand very clearly as a government that we can't be able to be everywhere. There are services which we are not able to meet the demands of the population, including in the area of cancer, because, as I said, there is an explosion of cancer. Just as before coming, I was just talking to some local people here and giving me very heart-rendering kind of personal stories of family members, young, one of them as early as 23, who has died from a brain tumor, a young man, also in his 30s, who's very sick with stage 4 colon cancer. So these are real stories, and we are not able to provide all the service. So we are really committing, and we've committed before with resources permitting. But also that's why I said to them, where we are not able from the public side, because we also have constraints. If there are private sector, businesses which they believe we could add a weight to strengthen their case for possible support, financial support and material support, we are available to work with them.
Right. And just an update that you also gave, a very important update on the status of those specialized machines that help in the fight against and treatment of cancer. What is the status? How many machines are we looking at? And when will they be in circulation and where?
Well, we are working with our colleagues in the various provinces to make sure that we improve our capacity in as far as there's two areas of there is the screening and the diagnosis first, including, for instance, your what they are doing here in terms of on the breast cancer, in terms of the mammography which they are doing here, and the pap smears with the laboratory tests which they are doing. We trying to make sure that those because the early detection is really the mainstay of being able to control the severity of and possible cure for cancer, and then beyond that the treatment. Now, in terms of treatment, we're still struggling with capacity, especially in our outlying, more rural provinces, and we're working with them to make sure that we can acquire those machines. I'm not able, at this stage to can say so many, but we're working with Mpumalanga, for instance, working with Limpopo, Northwest, Northern Cape, to make sure that they also can be able to access those machines, so that they don't have to bring all their patients to Gauteng and Western Cape, Cape Town and Durban in the big cities, because they're also getting overwhelmed.
Right, we'll have to leave it there. Thank you very much for that update. That was Dr. Phaahla, the Health Minister, giving us an update on, of course, that particular important aspect, which is early detection and early treatment. These machines, what the government is working on procuring and sending out to other provinces, as he mentioned, because currently it is very limited to urban areas like Gauteng, and this is not doing any work or any justice to the fight against cancer, particularly in trying to stem the tide of the high infection rates. With that, it's back to you in the studio.
Tumaole Mohlaoli there, and knowledge clearly is power when it comes to cancer diagnoses.